The number one most important number in a dental practice is staff salaries.
What?
Staff salaries. This is why. If staff salaries in a funded environment, which means I offer 401k match, health insurance, PTO, paycheck, right? Your payroll percentage should be somewhere between 23 and 25%. In a non-funded environment, which means all you get is a paycheck, it should be between 20 and 22. Now, there are other things to take into consideration too, like how long have the people been in your practice, right? But the argument still stands that if you've been in my practice longer, that's because you're more valuable, you're better at helping me enroll patients into care, you're better at helping me retain patients, and those things should translate into an increase in collections, which would in turn offset your salary percentage. Does that make sense? So if I go into a practice and their salary percentage is 35%, the very first assumption that I make is not bad culture, bad leader, bad communication. The very first assumption I make is out-of-date fee schedule, out-of-date insurance reimbursements, and they don't know how to schedule. I'm going to look at first their fee schedule. Is it out of date? Yes or no? Let's fix that. Secondly, insurance reimbursements. Your staff doesn't control where the doctor sets the fees, and they don't control if the doctor renegotiates their insurance reimbursements. They do control how to schedule. But who dictates the schedule? The doctor. I only want to do 1 crown a day. I only want to do crowns. I don't want to do seats. I don't want to do extractions. I don't want to do fillings. Right? So the doctor dictates. I want to come in at 9. I don't want to work past 3. I want to do $10,000.
3 days a week.
3 days a week. I'm only going to do crown and bridge. I want to do $10,000 a day. Y'all follow what I'm saying? We got to be realistic, guys. So your team doesn't have control over those things. So first I want to look at the things that aren't their responsibility, that are the doctor's responsibility. So I'm going to look at fee schedule, I'm going to look at insurance reimbursements, and I'm going to look at schedule. Now, they're partly responsible for the schedule. They're saying, I'd say 50-50, okay? Once I've identified whether one of those three things is a problem, if all of those things are perfect, like if their fee schedule is healthy, it's in the 80th to 90th percentile, their insurance reimbursements were just renegotiated last year, and they're block scheduling like they have been block scheduling for 40 years, and their staff salary is at 35%, we got a problem. There is something wrong with the culture in that practice. I can almost guarantee you.